Complementary and alternative therapies. Complementary and alternative therapies are defined as a broad domain of resources that encompasses health systems, modalities, and practices, and their accompanying theories and beliefs, other than those intrinsic to the dominant health system of a particular society or culture in a given historical period. Specific therapies that are alternative in one culture may be considered conventional in another culture. These two models are not totally separate from each other, and individuals may incorporate aspects of each of these models as they make their healthcare decisions. Traditional Chinese medicine is an alternative medical system that is a complete system of medicine unto itself. It incorporates a number of modalities to address the needs of each patient, similar to the Western medical system. The strengths of traditional Chinese medicine include its individualized system of diagnosis and treatment, as well as its focus on prevention. The most commonly used modalities are acupuncture and Chinese herbology. Acupuncture is helpful in chemotherapy-induced nausea. Acupuncture is the primary treatment modality used by traditional Chinese medicine practitioners. It is the most common complementary therapy recommended by U.S. physicians. In regard to benefit coverage by health insurance, it is the second most covered complementary therapy, with chiropractic therapy being the first. The conditions for which acupuncture is used are not limited to those in the list, but these are the most common and those found to be effective in clinical studies. The quality of herb preparations can vary, so it is important that the patients purchase herbal remedies from reputable manufacturers. When appropriately used, herbs are generally safe and have fewer side effects than conventional medicines. Many herbs prolong bleeding times, so further assessment of the type of herbs that are used and how recently they were used is needed before the patient has surgery. The other information given by the patient also requires further assessment, but will not affect the timing of the patient's surgery. Although herbal therapy alone may not eradicate the infection, some herbal therapies do improve immune function. Feverfew, ginger, garlic, and ginkgo biloba all prolong bleeding time and should be discontinued before surgery. Echinacea is usually safe to continue, and echinacea may have some benefit in reducing the incidence and duration of the common cold. Prayer is one of the mind-body interventions used most commonly by Americans. Prayer may have multiple forms. Meditative prayer involves openness to the divine and does not require words or thoughts. Ritualistic prayer involves repeated words or phrases and is commonly associated with formal liturgy. Colloquial prayer involves spontaneous thoughts and conversations with the divine. Intercessory prayer involves making a request for specific needs to be met. This is a personal decision and is not required of nurses. It is important to explore your own views. Self-assessment allows nurses to more fully meet patients' spiritual or prayer needs. Spiritual care. It is important to be aware that spiritual care is not an attempt or proselytize or win converts to a particular point of view. It is responding to a patient's expressed needs, and interventions are by their request or permission. Spiritual assessment and care should be sensitive and based on a relationship of trust. It will involve awareness of a person's culture, social, and spiritual preferences, as well as a respect for their beliefs and religious practices. Spiritual discomfort is the result of mortality's impact on patient and family. The patient is usually asking themselves whether their life has been worthwhile, and some wonder what life has meant and what does dying mean. Is there life after death? And if so, what will it be like? Even the most devoted people can have their faith shaken by emotionally distressing events. Others will express anger or outrage, and they feel cut off from their own soul altogether and feel a temporary paralysis of the spirit. For people who embrace religion, questions may arise from how could God let this happen to me? Any spiritual practice that brings comfort, strength, or healing to the soul is considered equally good and can be incorporated into the healthcare arena. When patients pray for guidance or strength, they may receive it. The answer may be the ability to accept what they have been denied or hope in the face of despair. When they stop bargaining and stop opening up their souls, prayer becomes an experience and not a request. It is a sense of being connected and of being a part of something larger than themselves. Biologically based therapies use naturally occurring substances and include individual biologic therapies such as shark cartilage to treat cancer and glucosamine to treat osteoarthritis, with diet therapy and herbal medicine. Now, natural does not always mean safe and effective. Even some herbs are plant-based, and the consumer must be knowledgeable about the products used. Online information sources are not always reliable, and the patient may need some teaching about safe use of herbal medicines. Some herbal medicines interact with drugs. For example, we talked earlier about ginseng causes bleeding when used with Coumadin, and ginseng increases blood pressure. Garlic reduces blood clotting and increases blood pressure. St. John's wort causes dangerously high blood pressure when consumed with aged cheeses, Chianti wine, or other foods high in tyramine. Any patient who is pregnant or lactating to consult a healthcare practitioner before using any supplements. Scientific evidence for use during pregnancy or lactation is limited. Manipulative and body-based methods include interventions and approaches to healthcare that are based on manipulation or movement of the body. Biofield therapy are based on the theory that energy systems in the body need to be balanced to enhance healing. Some forms of energy therapy manipulate biofields by placing the hands on these fields. Energy therapies are those that involve the manipulation of energy fields. They focus on these fields originating within the body, which is the biofields, and those from other sources, electromagnetic fields. Therapeutic touch is a method of detecting and balancing human energy that was developed in the 1970s by a nurse and a traditional healer. Healing touch involves the use of the practitioner's hands to realign the patient's energy flow. It is important for the nurse to collect data on patients' use of complementary and alternative therapies. This is especially important because most patients do not voluntarily tell their healthcare provider about their use of these therapies. However, they usually will share this information with a nurse when asked. Ask general open-ended questions while remaining non-judgmental and respectful of the patient's responses. Safety concerns encompass the reliability of information, the safety and effectiveness of therapies, and the regulation of practitioners. Regarding sources of information, patients most commonly get their information from health food stores, informal word of mouth, books, magazines, and the internet. Patients need to be encouraged to seek professional assistance with these decisions. Serving as a patient advocate, the nurse provides information on both conventional therapies and complementary and alternative therapies. Patients should be advised that complementary therapies do not replace conventional therapies, but often can be used in combination with conventional therapies. Self-care is essential on both a personal and a professional level. On a personal level, self-care involves commitment to maintaining one's own level of wellness. Keeping one's mind, body, and spirit healthy is required so that one has the strength to care for others. On a professional level, self-care is important because nurses are role models. They are role models for family, friends, patients, healthcare professionals, and the community. By demonstrating self-care practices, nurses motivate others to achieve greater health and wellness.